Hello everyone, welcome to another segment of PCS coding. As you've become more proficient coders, we've really coded from a statement, but now we're going to really look at how to code from an operative report. So let's take a look at one. This is an example of an operative report. We have the preoperative diagnosis, the postoperative diagnosis, a statement of an operation, type of anesthesia, and description of operative technique. Now, inexperienced coders will just code directly from the operation here. It'll say, okay, this is how I'm going to code. The problem with that with PCS coding is a statement, it doesn't tell you the approach, any device used, is a qualifier needed. It doesn't specify either the exact root operation you need. So that's why I say that this is for an immature coder. Our goal is to find out what the procedural statement is, and it's located within the description of the operative technique. Basically, it's called the operative narrative. It narrates each step of the procedure from putting the patient under anesthesia, starting IV, locating the surgical area. It includes incision, and then also at the back end, once a procedure is done, the procedure area is tested, sutures are applied, all these different activities. Once you separate all of these activities, you can identify what the physician is actually saying, what's going on, what the procedural statement is. We can, as coders, we can take the procedural statement and we can begin the coding process using our coding manuals. So when we look at something like this, the operative narrative is just a blank screen. We have no idea what this means. And when you get to your certification exam, you're going to have a limited amount of time. So how do I find it? Well, here's my trick. We determine pre-surgical and post-surgical activities. This video is based on the lecture of Unit 14 that is inside your My TLC course. Please take a look. There might be a more comprehensive list there. But examples of postoperative activities is prepping and positioning the patient for the procedure. The incision. Yes, I said the incision. People think the incision is surgery. It's not. It's the process of getting to the surgical area. So the incision is considered a pre-surgical activity. Anesthesia administration, inserting surgical instruments, and identifying the surgical area. Once we finish all these pre-surgical activities, you'll notice there's a procedural statement right in the middle. Right after the procedural statement, I will have post-surgical activities. Removing of surgical instruments, testing of the surgical area, stopping anesthesia, closing the surgical site. So if you research pre-surgical and post-surgical activities, they will give you information. Well, patient, before they have surgery, they have to go see the surgeon and make an appointment and get the blood test done to make sure they're qualified for the surgery. While those things are true, when we're talking about pre-surgical and post-surgical activities in the operative report, we're talking about these specific activities, not the activities that happen before or after the surgical period. So the trick is to develop this tool, we need to identify the pre and post-surgical activities. So what we do is we read each sentence of the operative report. If it compares to a pre-surgical activity, we highlight it in one color. In this case, I put yellow. Post-surgical activities are in a different color, and we highlight the procedural statement in another color. Most of the time, the statement comes before the procedure is describing the surgical area. Most of the time. Okay, so the report we just saw, now let's take a look at it. This is the same procedure. We can see that this has been dissected. And from this dissection, I can clearly identify that I have 4 separate codes or codes that I need to code. So the pre-surgical activities are in yellow. In this case, the patient was brought to the operative suite where the general LMA anesthesia was induced, preoperative. The lower leg and foot were widely prepped and draped in sterile fashion, preoperative. The patient had extensive area of gangrene involving the dorsum of the left foot, preoperative. The third and fourth toes were completely gangrenous, and the skin above and on the plantar aspect of the second toe were gangrenous as well. Describing the surgical area, this is preoperative. A sharp incision was used to remove all the dead tissue at the line of demarcation of what was alive and what was not. Again, the incision is considered preoperative. The underlying second, third, and fourth metatarsals were involved. Again, preoperative. The next statement, the infection was transected somewhat proximally, necessitating the complete removal of the second, third, and fourth toes. All of a sudden, I have a procedure because the infection was transected. That means they were removed out of the area. And I have 3 toes. Now in PCS, I can have multiple procedures because I have multiple body parts. So I have 3 separate body parts. So I have 3 separate codes already. The next line, a portion of the skin of the plantar aspect of the foot was debrided because the skin was also non-viable. I have another procedure here. So in this case, I have 4 procedures. This is excisional debridement of the left foot. So it's basically cleaning out the skin to take out all the dead tissue. Okay, so I have 4 codes already prospective here. Now notice, let's look at some of these post-operative activities. Fortunately, there was good bleeding at the margins of the wound once the necrotic tissue was fully debrided. I'm testing the surgical area, so this is a post-operative. This was controlled with electrocautery and 1-0 Vicryl ligature. I'm closing the surgical area. The wound was copiously irrigated. I'm prepping. Not prepping, after post-surgery, I'm just making sure that I don't have any bleeders and making sure everything is clean to prevent infection. Irrigated. So this is post-operative. Our intention was to treat this initially with the wound vac, but because there was bleeding that worsened with the application of the wound vac, this was abandoned and the patient was treated with Surgicel following sterile gauze, fluffed dressings, and an ACE wrap. Again, this is finishing the patient's surgery. This is just preparing for the patient to wake up to prevent infection. Throughout the procedure, estimated blood loss was approximately 150 milliliter. Again, data that's reported after the surgery is complete. She was transported to the recovery room in overall stable condition and tolerated the procedure well. This gives you the final narrative of the procedure, and it's complete. So this is post-operative. Thank you